When it comes to staying healthy and living longer, most seniors think about diet, exercise, or medication. But very few stop to ask themselves, how often should I actually be showering? Believe it or not, the number of times you step into the shower each week can have a huge effect on your skin, your immune system, your circulation, and even your risk of developing certain infections. Most doctors warn that seniors, especially those over 60, need to be careful about how frequently they shower. Some seniors shower too much, drying out their skin and stripping away natural oils. Others shower too little, which can lead to odor, skin irritation, and bacterial growth. So what's the right balance? That's exactly what we'll uncover in this video. Let's break it all down step by step, so you can discover the healthiest showering routine for your age, your body, and your lifestyle. Why showering habits matter more as you age. When you were younger, you might not have thought twice about showering every single morning, or sometimes even twice. A day after working out, playing sports, or spending long hours outside, a daily shower just felt natural. But as the body ages, your skin changes dramatically. Dermatologists explain that older adults tend to have thinner skin, less natural oil production, and reduced sweat glands. This makes the skin more fragile, drier, and more prone to irritation. Frequent showers with hot water and harsh soaps can strip away essential oils, leaving your skin cracked, itchy, or vulnerable to infections. On the other hand, not showering enough can allow bacteria and fungi to build up, leading to rashes and body odor, and sometimes even serious skin infections. Seniors with weaker immune systems are especially at risk. This is why showering is not just about feeling fresh. It's about maintaining the right balance for skin health, hygiene, and overall well-being. The risks of showering too often. Doctors often warn seniors against showering every single day, unless absolutely necessary. Here's why. Dry skin and itching. Hot water washes away natural oils, making your skin drier beneath. Seniors already deal with dry skin, and frequent showers make the problem worse. 2. Skin tears and infections. Thin, fragile skin in older adults can develop tiny cracks, which may invite bacteria. This raises the risk of cellulitis or fungal infections. 3. Worsening of eczema or psoriasis. If you already have skin conditions, daily showers can irritate them further. 4. Weaker natural barrier. Your skin acts as a shield against germs. Overwashing reduces its protective layer. 5. Hair and scalp damage. Washing hair too often can make it dry, brittle, and itchy. So while showering feels refreshing, too much of it can silently harm your body over time. The risks of showering too little. On the flip side, not showering often enough can also create problems. 1. Bacterial buildup. Sweat. Dead skin cells and natural oils create the perfect environment for bacteria. 2. Fungal infections. Seniors are more prone to athlete's foot yeast infections and toenail fungus if hygiene is neglected. 3. Body odor. Skipping. Showers can lead to unpleasant odors affecting confidence and social life. 4. Skin irritation. Accumulated. Dirt and sweat can clog pores and trigger rashes. 5. Complications for medical conditions. Seniors with diabetes or weakened immune systems face higher risks of infection if hygiene is poor. Clearly, too much or too little showering both have consequences. So, how often should seniors shower? Now, to the most important question, what's the doctor-approved answer? Most dermatologists and geriatric specialists agree that seniors should shower about 2 to 3 times per week. This frequency is enough to keep the body clean and healthy without over-drying the skin. Of course, this can vary depending on personal needs. If you sweat a lot, exercise regularly, or live in a hot climate, you might need an extra rinse. If your skin is very dry or sensitive, cutting back to 2 showers a week with gentle cleansing is often best. On days you don't shower, a quick sponge bath or washing of face, underarms, groin, and feet can keep you fresh. Doctors emphasize that it's not about strict numbers, it's about balance and listening to your body. Tips for healthier showering in seniors. Knowing how often to shower is just the start. How you shower matters just as much. Here are some doctor-recommended tips to make every shower healthier and safer. 1. Use lukewarm water. Not hot. Hot water strips oils and worsens dryness. Warm water is gentler. 2. Keep showers short. Aim for 5 to 10 minutes, not long soaks. 3. Choose gentle, moisturizing soaps. Harsh, antibacterial soaps aren't needed. Mild cleansers are better. Or moisturize after showering. Apply lotion or body oil within 3 minutes of drying off to lock in hydration. Be careful with hair washing. 1 to 2 times per week is usually enough for seniors. 6. Watch for skin changes. If you notice redness, rashes, or unusual dryness, adjust your routine or talk to a doctor. 7. Practice safety in the bathroom. Use non-slip mats, grab bars, and a shower chair if needed to prevent falls. These small adjustments can make showering safer, more comfortable, and much healthier for seniors. The link between showering, circulation, and longevity. Showering isn't just about skin health, it also affects circulation, mental health, and quality of life. Warm showers can relax stiff muscles, reduce joint pain, and improve blood flow. They also relieve stress, promote better sleep, and lift mood. On the other hand, overshowering or using harsh products can create chronic skin issues, which in turn affect confidence, social interactions, and even immune health. Seniors who neglect hygiene may face higher risks of depression or isolation due to embarrassment about odor or appearance. Doctors point out that something as simple as a balanced showering routine can help seniors stay socially active, physically comfortable, and mentally positive. Important keys to longevity. Shower alternatives for seniors. Some seniors may have mobility issues, arthritis, or fear of slipping in the shower. In these cases, alternatives can still keep hygiene in check. Sponge baths. Using a warm washcloth with mild soap to clean essential areas. No rinse cleansers. Special wipes or foams that don't require water. Bathing assistance. Caregivers can help maintain dignity while ensuring hygiene. Foot soaks. Keeping feet clean is vital to prevent infections, especially for diabetics. Maintaining hygiene doesn't always mean a full shower. It means finding safe, practical ways to stay clean. Cultural habits versus medical advice. In many Western cultures, daily showers are seen as the standard of cleanliness. But doctors remind us that this is more of a cultural habit than a medical necessity. In fact, many countries around the world consider bathing every other day, or just a few times a week, completely normal, and these populations often have healthier skin. Letting go of the daily shower mindset can feel strange at first, but once you understand the medical reasons, it becomes clear why less can actually be more. When to shower more frequently. There are a few exceptions where seniors may need to shower more often. After exercise or heavy sweating, if you've been exposed to dirt pollution or strong odors, during hot, humid weather, if you have certain skin conditions that require cleansing. In these cases, doctors suggest rinsing off with water only or using mild cleansers instead of full soap. Scrubbing every time. When to shower less. Seniors with very dry skin, severe eczema, or open wounds may benefit from showering less often. In these cases, a dermatologist can recommend special routines, such as oil baths, oatmeal soaks, or medical cleansers. At the end of the day, showering is not just about hygiene. It's about protecting your skin, maintaining dignity, and supporting your overall health. Doctors warn that both extremes, too much and too little, can hurt seniors. The sweet spot is usually 2 to 3 showers per week, with gentle products, short durations, and proper moisturizing afterward. Combine this with good hygiene practices on non-shower days and you'll have a balanced routine that keeps you fresh, confident, and healthy well into your golden years. Your skin is your body's largest organ, and taking care of it is a lifelong investment. By adjusting your showering habits, you're not just protecting your skin, you are protecting your health, your comfort, and even your longevity. So how often do you shower right now? More than doctors recommend or less? Share your routine in the comments. Below, we'd love to hear your thoughts. And if you found this video helpful, don't forget to like, share, and subscribe for more health tips for seniors.